there's been a lot of frustration over the weekend. I'm sure you've heard around Pfizer being used from some larger companies and workplaces here in BC, including now a cabinet maker. Can you explain why these companies are being prioritized with Pfizer? Why not close down some of these businesses, ask people to isolate as we've seen with outbreaks and other positive cases, especially because it takes up to 3 weeks for the vaccine to work? Can you explain that part as well? And are you worried about prioritizing these businesses, meaning other businesses may want to have outbreaks in order to access the vaccine?
I would hope not. I don't think anybody wants to get sick with this virus. And it is a reality that we have been focusing on outbreaks in our communities, and we use the vaccine that we have available. We used it to manage outbreaks that we had in correctional facilities, for example, to manage outbreaks that we've had in certain areas. And the businesses are closed down when they have an outbreak to make sure that we are able to effectively isolate people. All of those other things are in place as well. But what we have learned from some of these larger workplaces, particularly we've seen this repeatedly with some of the food processing plants and a number of those were workplaces that vaccination was it was one of the part of the outbreak control measures. So yes, we do close them down. Yes, we do make sure that people are isolated, that they're tested, that they have to stay home, that their family and their close contact are isolated as well. But we now have another tool that we now know is effective in helping us prevent that ongoing transmission that happens in families and communities and back and forth into the workplace. And so those have been prioritized and will continue to be prioritized with the vaccine now that we have from the AstraZeneca, because it's much more flexible. We're able to keep it in the fridge and use it in smaller amounts, but we need it to take the actions that we've been doing in various outbreaks around the province since we've had vaccine available, but only since we've had enough available that we've been able to focus on some of those smaller clusters and outbreaks as well. So it is part of our public health response to putting out the community outbreaks. It's not about prioritizing one specific industry. It's about addressing the outbreaks and clusters that are ongoing in our communities now that lead to that extra layers of transmission. And we're going to see more of that. That is what we're using this alternate or parallel track for, to best protect and stop transmission in the community. And we'll be having more details about that. But right now, that means looking at some of those industries where we have ongoing repeated transmission events and outbreaks that are making people sick, that they're bringing home, that they're taking, that people are ending up in hospital, and where workplaces are very challenging to make safe. So we do all of those things in those workplaces. In terms of businesses, we've not deemed businesses essential. Everybody is essential. There are many things that are essential to our livelihoods, our social and emotional well-being and other things. What we are looking at is the businesses that are operating using COVID safety plans, where there is an ongoing risk in the workplace to workers in those settings. And we have done a lot of analysis of those settings, and there are some where it's more challenging. There's larger numbers of people. It's more challenging for the COVID safety plans to be adhered to, and it has effects on worker safety that reflects into our communities. And so that's why we're focusing on the ones that we know need to stay open, the agricultural, where we're in group living accommodations, where there's the food processing plants, some of the light industrial plants are important, some of the manufacturing where there's larger numbers of people and workers where it can spread very easily, and some of the mail depots and distribution centers as well. So it is where outbreaks are happening in our community right now. Everybody is essential, we know that.